is healthcare in the United States so expensive?
Overall spending on
We spend
healthcare
more
has
money on
doubled
healthcare
over the past
than
2
any
decades.
other country in the world.
The U.S.
$1.2
spends about twice as much on
Healthcare spending is
healthcare
rising
than
around the
other
world.
large
But they
developing
cannot
countries
escape the
do.
huge cost of healthcare.
Healthcare costs have soared over the years, burdening many families with expenses they can't afford. Medical debt and bankruptcy affects nearly 20% of all U.S. households annually. Even though the healthcare industry is worth almost $1 trillion, communities still struggle to afford healthcare. But what if there was a solution? Introducing VirtuCare, healthcare for all. Our innovative platform revolutionizes healthcare by leveraging image detection AI software to provide medical advice and information remotely. Here's how this 5-step process works. Step 1, initial assessment. Patients will fill out a simple questionnaire on our website, providing essential health information. Step 2, image submission. Patients can upload pictures of injuries to our website. These images will then be scanned and analyzed by our AI model for immediate concerns and symptoms. Step 3, AI analysis. Our artificial intelligence model will utilize image recognition technology to scan for any anomalies or potential health issues. It will create a checklist of possible areas for further examination. Step 4, symptom inference. Using the patient's medical information and history, the AI will infer potential symptoms and suggest possible problems and remedies. Step 5, doctor consultation. Based on the AI's analysis and the severity of the concern, the patient may be scheduled for a virtual consultation with a doctor. Now you might be wondering, how would all this actually work? VirtuCare is dedicated to partnering with medical experts who are willing to volunteer their time and expertise. Currently, 38% of all doctors volunteer at local clinics and hospitals. Since our platform is online, it is easier than ever for doctors to volunteer their services. With these partnerships, we hope to reach communities all over the world, specifically underserved communities. Untapped market. Over 30 million Americans are underinsured, unable to afford health insurance, deductibles, and copays. This represents massive untapped demand for affordable healthcare options. Creating new demand. Our free platform essentially creates new demand by making virtual doctor consultations accessible to millions who are priced out of the system. Uncontested market space. No other players directly connecting patients with doctors willing to volunteer time for pro bono consults and second opinions. Low cost structure. As an online platform, we avoid expenses associated with hospital systems and traditional doctor offices, allowing us to offer free consultations. Scalability. Since we're a cloud-based platform, we're capable of rapid national and even global expansion to serve more patients in need. Social impact differentiation. We're creating both societal goodwill and public health outcomes, which distinguishes us from profit-driven healthcare players. There are many factors that differentiate us from our competition. We use AI to diagnose milder symptoms, and we save our doctors and nurses for more severe cases. When VirtuCare is compared to the different treatment providers available, we fill in the needs that other companies can't provide while saving time and resources. By pursuing differentiation at a low cost, we move into a blue ocean full of new demand. At VirtuCare, we seek to eliminate high premiums and out-of-pocket costs. By doing this, we reach more people, bringing affordable healthcare to all. Next, we want to raise accessibility to virtual care, and in doing so, we generate more revenue without financially burdening people. We want to reduce these factors. Afterwards, by reducing wait times, paperwork, and frustration and worry, we treat people quicker and save more lives. Lastly, at VirtuCare, we seek to create a cheaper, faster, and safer healthcare for all, regardless of background, race, identity, or gender. Initially, our target audience would be families with financial issues. Then, we would seek to grow our company and target young adults in urban cities. Afterwards, we would try to target adults in rural areas that don't have great access to healthcare. Lastly, once our presence and brand is established, we would help underserved international communities who do not have access to healthcare. We're in the process of patenting our AI technology, and we plan on partnering with tech giants in the AI industry. We qualify for over 23 technological grants, and we hope to make a difference in the world. Given the high value of customers, cost per click rates in the healthcare and pharmaceutical industry can be very high, often ranging from $1 to over $10 per click, depending on the specificity and competition for the keywords. Assuming a click-through rate of 1%, which is a general benchmark, but this can vary, and an average CPC of $3, if we get 67 million views from our website, we can then generate a profit of $2.01 million. VirtuCare outperforms competitors in terms of accessibility, cost effectiveness, and social impact, making it the future of our healthcare.